Hi, hello friends, welcome to World Explorer India. May 28 is celebrated as Menstrual Hygiene Day. This year hashtags are #Mhday 2022, hash period education for all, and hash Wearecommitted. In this diagram you can see there is an uterus and fallopian tube and vagina, and also there is a bracelet symbol on which we see the red beads. This is being celebrated this year to remark the menstrual cycle. And also you can see in the middle diagram there is a safety pad, which is again very essential for the menstrual hygiene. So in this video I am going to talk about what is menstrual hygiene and also some of the diseases which women are going to experience in their life, and what are the management techniques, and also how we can avoid the taboo and also misconceptions about the menstrual cycle. Unicef is working on promoting the menstrual hygiene, and it is saying that gender inequality, cultural taboos, poverty can lead to menstrual health needs go unmet. And also majority of the time the women who is attaining the puberty age, they are going to have their first menstrual cycle without having any knowledge about the menstrual cycle, because the first menstrual cycle occurs around 10 years, or it may vary from 10 to 16 years of age in a female. But if there is no proper education being given to the children, they may go into panic, and also sometimes there is a bullying among the school students, especially from the boys. So this is happening in nowadays. So it is better to educate both the male and female, that is boys and girls, so that there is a need for support for the woman who is experiencing such situation. And also there should be enough provision of toilets, sanitary products, hygiene needs, so that it can be very helpful for these children. And also there is a need for social support and enhancement of the knowledge and skills, facilities, services. Access to these safety pads or absorbent materials, etc., is very much essential. Menstrual cycle starting, that is what we say attainment of puberty age, in some of the countries it is being celebrated, and in some of the countries it is a agony. Means if we see country like India, women who has got first puberty is being celebrated, and they are equivalent to goddess, or we pray them, and we do some of the spiritual activities. But in some other countries it is a agony for the children, because they don't have any proper education related to the menstrual cycle or menstrual hygiene, and because of which the women are undergoing the shame and isolation, and also they are getting bullied, and also because of which they are going to leave the school, because of which they can see increased school dropouts, and is affecting their career also. So it is very essential, not only the women should be educated, but also the men should be educated about the menstrual hygiene. And majority of the time usually the female caregiver or mother are going to explain to their children about the menstrual hygiene. But Fathers and male person also should be encouraged to discuss about such topics so that it will give a lot of emotional support to their children. So, in our society, there is a need for change of attitudes related to the menstruation. What we can do is we can give proper education in the schools and also in the societies and also to the poor persons, and also we need to involve the religious leaders and also the politicians and school teachers and any significant person who can influence the behavior and attitude of a society. That means if we are using influencers for promoting health education, it is having very much good impact. So again, next thing is we have to give high priority to the personal hygiene, and during menstruation women are losing the blood, because of which they may lose iron and also they may go into anemia. So appropriate proper nutrition should be given to the women, and they should be taught about um, iron rich diet, where we can get iron rich diet. That is it's like green leafy vegetables, pulses, or apple and dates, jaggery, and etc. So all these things which has high content of iron, so these type of foods can be given to the children or women so that they can replenish the lost iron through the menstruation, and also they will get anemia prevention. And also the women should be taught how to use the sanitary pads and what are other alternative measures being available. So talking about menstrual hygiene is the necessity for not only the women but also the men. And there is a lot of ongoing debate in India right now whether can menstruating women enter a spiritual places, and we have seen that lot of women movements has happened and also supporters, and also there are other persons who are not supporting the situation. So this is a still ongoing debate even though there is a Supreme Court order. And next thing is, in some other countries they feel that if a woman undergoing menstruation should not cook food or should not do any activity, means they feel like menstruating women as a sin. But it's not the reality, because menstruation is a natural process which occurs for each and every woman. So menstruation is a good thing, and it has no sense related to the bad thing. So there is a lack of education or lack of knowledge related to menstruation may lead to development of such attitudes. So there is a need for good health education for the societies. And also they should be taught about poor menstrual hygiene will cause urinary tract infections, and again it may lead to infertility also. So without proper menstrual hygiene, the women will get severe problems of urinary tract infections, and also ultimately it may lead to infertility. So who should talk? It is the responsibility of each and everyone so that we can develop a supportive and cooperative societies, and also the women or the girl adolescent girls, they should have a sense of security and they should not get any fear or afraid. This is possible only when each and every person takes the responsibility. It can be the mother, father, sister, brother, friend, doctor, nurse, teacher, and also the television, books, radio, magazines, internet, media, and mass media. They should play a great role in such situations. On average, there are 450 cycles each woman will undergo in 38 years of life. And menstrual blood is composition of arterial and venous blood along with prostaglandins, tissue debris, fibrinolysis of endometrial tissues. And usually it lasts for 4 to 5 days. Menstrual bleeding lasts for 4 to 5 days, and this is happening after the ovulation process only. If ovulation means there will be ovum will be released from the ovary. If it is not getting fertilized, if then they it is going to get out of the uterus, and that process is called as menstruation. So what will happen during the menstrual cycle is there will be the bed formation in the uterus, that is a rich vascular supply, that is it is having blood supply, and it is preparing a bed for the baby to grow if fertilization happens. If there is no fertilization happens, this bed will come out with the clots and as we have discussed, prostaglandins, debris, etc. And women will have a next cycle, and again there will be a continuous cycle. Usually menstrual cycle is of 28 days, and one thing which everyone should remember is ovulation occurs on the 14th day. Around the world, women use different types of materials such as cloths, reusable sanitary pads, single-use sanitary pads, tampons, menstrual cups, toilet paper, cotton wool, underwear alone. So, women should be taught about the best possible methods for menstrual hygiene, and also it should be cost effective. So menstrual process is a natural process of life which needs dignified and healthy attitudes to be developed among the individuals, societies, males and females. Menarche is the onset of menstruation. Menstrual hygiene includes use of clean absorbent material, that is pads, cloths, tampons, cups, etc. And women need a privacy places such as toilets in the schools and workplaces, etc. And there should be availability of soap and water, and facilities to dispose of the used materials. So each and every woman should have the dignity, and they should not have no fear with the supported community. These are the internal structures in a female, that is two ovaries, two fallopian tubes, and uterus and vagina is present. Ovaries release the ova, which transfers to the uterus via fallopian tube, and if it is getting copulated, it is going to uh, become embryo, and it is going to form the baby in the uterus. If there is no fertilization occurs, all these contents will come out through the vagina, and through the and it is going to be coming out as a blood. So menstrual cycle occurs usually after 2 weeks of copulation if ovum is not fertilized, and ovum is going to become corpus luteum, that is because of decreased progesterone hormone, and it is becoming corpus albicans, and then endometrium degenerates, sheds, and this process is called as menstrual cycle. Usually menstrual flow is of 4 to 5 days. Normal loss is 30 to 60 ml of the blood. Endometrium becomes thicker, vascular again, and prepare for the further pregnancies. These are the ovulation stages. Ovum becomes it is like primary follicle becoming mature follicle, again ovulation, corpus luteum and corpus albicans. These hormones play very important role in the menstrual cycle, that is estrogen, progesterone, and also menstrual disorders seen in some of the disease conditions such as hyperthyroidism. If there is a bleeding between the menstrual periods, and if there is any unusual discharge and painful menstrual periods, heavy periods, etc., these are the warning signs of cervical or uterine cancer. So they should reach out gynecologist immediately. PAP test is called as Papa-Nicolau test, is a diagnostic test for the cervical cancer. It is a screening tool usually done 2 weeks after the last menstrual period. You have to schedule the appointment with the gynecologist and have to avoid intercourse for 2 days. Stop using vaginal medications at least 48 hours before. Cramps are common after the procedure. Next condition is premenstrual syndrome. Around 7 to 10 days before the menstruation, women are undergoing some of the psychological symptoms along with the physical symptoms such as depression, anxiety, irritability, lethargy, insomnia, forgetfulness, confusion, and also physical changes such as swelling, breast tenderness, abdominal bloating, palpitations, weight gain, constipation, headache, and rhinitis, menstrual cramps, painful intercourse, pelvic pain, backache, etc. And also there are weight changes. So women who is undergoing premenstrual syndrome, if not controllable, they should advise, they are being advised to maintain a menstrual diary. That is, they have to record these symptoms in a diary in a date wise manner, so that they can show to the gynecologist and they can get the proper treatment. Treatment may be hormonal therapy or sometimes antidepressant medications, or it may be painkillers like analgesics, and sometimes vitamins. Amenorrhea is absence of menstrual flow. Primary amenorrhea is never menstruated woman, that is, there is no onset of menstruation even after the puberty, that is in the reproductive years. Secondary amenorrhea is, it is not because of any abnormality, but it may be because of the pregnancy or menopause or during the lactation phase while mother is breastfeeding the baby, or because of hysterectomy. Hysterectomy is the removal of uterus from the total abdominal removal of hysterectomy. That is removal of uterus from the body. Next thing is oligomenorrhea, that is decreased flow of the blood. It is very common in female athletes, and also the anorexia nervosa. Anorexia nervosa is the adolescent may not be eating properly and they are undergoing loss of weight, that is significantly, maybe around, we can say, 10 to 20 kgs in a month or in last 2 months, etc. So this is very abnormal. So if they are undergoing lot of weight and they present with amenorrhea, so amenorrhea can be psychological symptom. And also premature ovarian failure and PCOD, these are the very common causes for oligomenorrhea or amenorrhea. Dysmenorrhea is the painful menstruation. Primarily the cause is unknown. Secondary, it may be related to the fibroid uterus or endometriosis. This will be manifested as abdominal pain, cramping, and fatigue, and the treatment includes analgesics and also local heat applications, warm showers, and also knee chest position, and simple stretching exercises, rest, and nutrition. So any unusual bleeding needs the gynecological consultation to evaluate the causes. And menorrhagia means excessive bleeding during menstruation. Metrorrhagia means vaginal bleeding in non-menstrual periods, and also some of the disease conditions can cause oligomenorrhea or amenorrhea, such as endometriosis, and one of the condition called as dysfunctional uterine bleeding, it needs urgent gynecological intervention. So these are the trending topics for this year, that is menstrual matters, Mhday 2022, menstrual hygiene day, menstrual cycle, menstruation, Endperiodstigma. This is the bibliography from which I have taken the majority of information, that is Unicef and internet search for the terminology and some of the disease conditions and personal experiences. Do like this, subscribe, and share among your friends. Thank you.